was to develop a solution that could help the healthcare staff to face the difficulties to become infected when working close to the patients. So the idea, the concept of the project was to develop a cyber-physical system for telemedicine and intensive care, which we call the CPS4TIC framework. So this solution will enable that the healthcare workers can develop the clinical activities not being close and in the place where the infected patients are staying. The main contribution of this project in terms of technology solution is to bring already available solutions and technologies that are in use already in healthcare, but also in other domains like in industry, considering, for example, the Internet of Things case where many sensors have been in use for manufacturing and now adopt them and bring them for the healthcare domain. Also, it's very relevant the need that this project had to face to integrate the different devices that are around a patient bed and integrate it with patient data management system. And here, the interoperability aspects on the integration of the data with the telemedicine system is a very valuable asset for this domain. Why? Because nowadays, typically in the hospitals, the data of a patient, even if it is standardized, is mostly distributed and not integrated. And with this solution, we are stimulating that we can have an integrated platform where we can access to the data anywhere, anytime. And using the telemedicine facilities, this even expands this concept because we are creating an international hub of telemedicine through the links that the apps where we install the solution are using the project technology. And with that, this means we can have a universal solution of interoperability of electronic health records, which is really a major asset. I can be here, I can be anywhere, my health data can be accessible, and even more, with this system I can have, for example, my doctor taking care of me wherever I am. The results of this project have also a strong impact in the change of the daily life of the doctors. Just the need, they don't need to go to the intensive care units or to the infected areas to solve specific problems. And using the cockpit, they can manage different beds seated in the same place and talk and discuss with the colleagues what's going on is really a major advantage. And this creates a new paradigm in the way I see the doctors are reorganizing the work they do. Because rather than move bed to bed every time, which I found very much tiring, they can be seated in front of the cockpit and from there manage the different beds. But more than that, if we have the system integrated in a network, we can have the main hospital and peripheral hospitals or even health centers where the doctors don't need to move to the health centers if there's the need of some specific activity as a doctor, clinical activity. So this is really very important. And for example, in places like ultra-peripheral regions in Europe, like the case of Madeira or of Azores that are based in different islands, if we have a patient that, for example, is in Porto Santo, that is a small island out of the main island, that is Madeira Island, this patient, mostly of the times when there is find a need, is moved by helicopter or by plane to the main hospital. And using this solution, this can be at least assessed properly remotely, and probably in most of the cases, even the need of the transportation of the patient can be avoided. And my vision is that in the near future, the healthcare workers as citizens deserve to take advantage of all these technologies in order to improve their quality of work, quality of life, during the work and even outside when they are on vacation, at home, whatsoever. The most exciting moment I felt in the project was when we did the first installation of the hub that was in Madeira Island with the support of the government of Madeira. And I saw the director of the intensive care unit and the staff around, nurses, other doctors, able to communicate and work with the colleagues that were abroad in the other island. And surprisingly and by chance, there was an accident in that island and there was exactly a patient needing support. And in that moment, even during the demo, they were able to immediately provide advice and support that person that was in risk of life. This was really a fantastic moment that paved the way for what we are developing now as the integration of the different apps that are now in place all over Europe through the network of ICU4Covid.